My name is Jacob Goldberg. I'm a neurosurgery resident at Weill Cornell Medical Center, New York Presbyterian Hospital. This presentation, Basic Science of the Spine, Spinal Anatomy, is made to support the corresponding book chapter, Spinal Anatomy, in Yeoman's Neurological Surgery, Edition 8. By the end of this presentation, one should have a brief overview of our spinal anatomy chapter in Yeoman's, a general overview of the organization of the spine, and be able to refer to our chapter in our bibliography for detailed questions that arise when studying human spinal anatomy. The spine is generally organized to provide stability while protecting the important associated neural elements housed within it. The normal sagittal balance of the spine, the sum of the cervical lordosis, thoracic kyphosis, and lumbar lordosis, allows normal upright posture to be maintained with minimal muscular exertion. The human spine is arranged into 24 presacral vertebrae, 7 cervical, 12 thoracic, 5 lumbar, and 5 fused sacral vertebrae. We detail in our chapter that variations from this general pattern happen with a fair amount of frequency, between 3 and 30% of the population depending on the case series studied. For neurosurgeons, it is imperative to recognize when such variations exist to ensure that surgery is performed on the intended spinal level. In the corresponding chapter, we detail several naming conventions that can be used when preoperatively planning spinal surgery when a variation from the normal segmentation pattern exists. The atlantoaxial spine is a unique segment of the spine between the occiput and the subaxial cervical spine, comprising C1, C2, and the occiput. This segment supports the head's weight and permits head flexion extension via the articulation with the occipital condyles. This segment of the spine is often implicated in cervical spine trauma, in that injuries are often seen to the bony or ligamentous structures making up this segment of the spine. The ligamentous anatomy is detailed on the next slide. Clinically, the assessment of the integrity of the transverse ligament in the setting of trauma involving the atlantoaxial spine can be made using the rule of Spence. The rule of Spence is a radiographic method that attempts to determine the integrity of the transverse ligament when doing an open mouth odontoid view radiograph, as pictured on the left. Classically, this is done by assessing for overhang of the lateral masses of C1 compared with C2. If the lateral masses of C1 overhang C2 by greater than 6.9 millimeters combined, transverse ligament injury may be suspected. The wide range of motions that occur around the atlanto-occipital junction are stabilized by an extensive network of ligaments. The anterior and posterior atlanto-occipital membranes attach the occiput to the superior borders of the anterior and posterior arches of the atlas. These ligaments that join C1 and C2 and the tectorial membrane help resist overextension. The anterior arch also attaches to the anterior longitudinal ligament and the longus colli muscles, extending inferiorly to the axis and subaxial spine. The axis, C2, provides the majority of the neck's axial rotation via its odontoid process, which projects superiorly from its body. This articulation is stabilized by the transverse ligament across the ring of the atlas anteriorly, which restricts anterior translation of the atlas with respect to the dens. On the prior slide demonstrating an odontoid radiograph, we discussed the role of Spence as a clinical tool in assessing transverse ligamentous integrity. Stability around C1 and C2 is conferred in part by the cruciate ligament, comprised of the superior longitudinal band, transverse ligament, and inferior longitudinal band. The dens is further reinforced to the basion via the vertically oriented apical odontoid ligament and the alar ligaments joining the dens to the medial occipital condyles, which serve to limit lateral flexion and rotation of the head in the upper cervical spine. The remainder of the cervical spine is characterized by more conventional spinal motion segments. Notable features of this portion of the spine include encasement of the vertebral arteries generally from C1 through C6 in the transverse foramen. In contrast to the remainder of the spinal nerves and other spinal segments, cervical roots are named according to the vertebra below each nerve, with the exception of C8, which courses between C7 and T1. This picture is borrowed from the online Roten collection. The unstent process is highlighted in yellow. Unstent processes form the uncovertebral joints, which restrain lateral motion in the cervical spine. The uncovertebral joint is an important surgical landmark in anterior cervical discectomy and fusions, as it marks the anterior and lateral extent of the disc space. The thoracic spine consists of 12 thoracic vertebral bodies. It is characterized by substantial stability owing to its costal articulations. Each rib articulates with 2 vertebral bodies, which in turn harbor superiorly and inferiorly oriented costal demifacets, found near the pedicle roots superiorly and originating from the pedicles at the lower thoracic levels for the ribs above and below. Exceptions are listed on the slide. As is the case in the cervical spine, the laminae are imbricated. The transverse pedicle angle decreases from approximately 30 degrees at T1 to 0 degrees at T12 in the axial plane. Articular surfaces of the facet joints are in the coronal plane towards the superior thoracic spine and gradually reorient into a sagittal orientation by the lumbar spine. Of note, the kyphotic apex of the spine is typically around T8, which also corresponds to the narrowest cross-sectional area of the spinal canal and the most oblique spinous processes in the spine. The lumbar spine typically consists of 5 lumbar vertebral bodies. The lumbar segments are characterized by the spine's largest vertebral bodies, particularly as a result of increased width, which subserve the largest axial loads seen in the mobile spine. The laminae are also wide, commensurate with lumbar lordosis and the prominent sacrovertebral angle. Ventral body heights decline from approximately L2 to L5. Lumbar pedicles are correspondingly robust, with transverse pedicles dramatically larger than those at higher levels. They range from 10 to 18 millimeters in size. Transverse pedicle angles increase from 0 at L1 to approximately 30 degrees at L5. The sacrum consists of 5 fused vertebral bodies. The sacrum is a triangular, anteriorly concave bone bridging and sharing loads between the spine and pelvis through its complex articulations, with L5 superiorly, the facet articulations facing medially and posteriorly, the ilium bilaterally, and the non-load-bearing 4-level coccyx inferiorly. In the sagittal plane, the sacrovertebral angle's prominence is due to a superiorly forward pelvic tilt with respect to the lumbar spine. The spinal cord nuclei and white matter tracts are somatotopically organized according to modality. Although a vast majority of neuronal cell bodies within the gray matter are interneurons, specific nuclei, as defined topographically, correspond to specific functionality. 31 pairs of ventral and dorsal roots emerge from the spinal cord on each side, combining into a mixed spinal nerve. Dorsal and ventral components exit the spinal canal below their correspondingly named levels, except in the cervical spine, in which they exit above. Dorsal root sensory ganglia are located within the spinal canal and proximal neural foramina. Tracts within the spinal cord respect the medial-lateral topographic principle. Afferent pathways entering at higher levels remain lateral to those serving lower levels, and descending efferent tracts innervating lower levels remain lateral, whereas more proximal groups synapse medially onto gray matter more proximally.